So everybody's heard of menopause, but have you ever heard of something called manopause? It's not a misnomer. I'm actually stating something that is known in the medical community. The technical term would be either andropause or what we call hypogonadism. What it basically is saying is that men can have hormonal changes, much as women do as they get older. The primary hormones that men have to deal with are testosterone and something called DHEA. Now, interestingly, the testosterone levels in men tends to peak when they're very young, around the age of 19. At that time, testosterone levels are generally extremely high, and the effects of testosterone are very visible. Over the years, though, as men get older, the natural tendency is for the testosterone levels to fall. They usually come down fairly slowly, and by the time you hit into your late 60s, early 70s, they've come down to a reasonable level. But what happens in some people, interestingly enough, is that the levels come down much more rapidly. So some men, when they hit in their 40s and 50s, may have the same testosterone level as a man in his 70s or 80s. The problem with this is that when you lose testosterone, there are effects on your body composition, meaning that you don't have the ability to build muscle as readily, and you're going to store fat more quickly. And usually when you store this fat, it's around the midsection. So if you have extremely low testosterone levels at an early age, your chances of becoming overweight or obese are greatly elevated. In my clinical practice, I would estimate that somewhere between 30–35% of the men who come in who are seriously or morbidly obese have low testosterone levels. So it's important for you to be screened and tested for this. And if you think you have any of the symptoms of low testosterone, loss of libido, difficulty with erections, loss of energy, all these things may be clues. So it's important to know your testosterone level and make sure that you have this checked to make sure you're not dealing with this menopause condition.